IDAlert features interventions in Greece. In the region of Attica, we will showcase 3 unique environments: Marathonas, Psythas, and the municipality of Athens. You'll see examples of interventions being implemented here on the ground to manage current risks and future-proof against potential infectious disease threats. The Binaiki Phytopathological Institute, an IDAlert partner, leads this initiative with key governmental and institutional entities.
Established in 1929, Binaiki Phytopathological Institute was the first Greek research institute to have a broad scientific basis in plant health and plant protection. Since then, our institute has earned itself a reputation as a guardian of quality, safety, and sustainable development in agriculture. Regarding mosquitoes, our qualified staff knows the state of the art for mosquito management, and its research is always in line with the EU policy regarding the sustainable use of biocides. We aspire to achieve a balance between the maximum effect of selected interventions and to minimize the risk to our populations and environment. Therefore, we carefully select our surveillance strategy and adapt it according to the aim, the expected outcomes, and the targeted mosquito species, native or invasive.
The region of Attica is the largest region in Greece with about 3.8 million inhabitants and quite a diverse land use. It also is the location of our capital city, Athens. The public health services of the region are responsible, among a variety of other things, for vector control. In recent years, the magnitude of the threat of vector-borne diseases seems to have increased with climate change. We found ourselves looking for a more integrated umbrella approach that would include constant entomological and epidemiological surveillance, a type of a kind of early warning system to inform our vector control actions. We approached the Binaiki Phytopathological Institute and enlisted their scientific support, at the same time making our cooperation with the National Organization for Public Health more structured and working closer with them.
Currently, mosquito control is mainly based on integrated pest management, relying on the combined use of several mosquito control tools, selected according to evidence provided by surveillance.
The establishment of a consistent, reliable and sustainable long-term surveillance system is therefore a critical component to any successful mosquito control program in order to make informed decisions and respond appropriately to changing mosquito populations.
All kinds of traps have been placed in shady, safe and easily accessible positions. These positions are kept fixed over the years and the precise description of each station have been given in a specific database. We perform weekly collection of samples. The samples collected in the field are transferred using a cold chain process. We put the mosquito samples in the refrigerator at -20 Celsius degrees and then, after 2 to 3 hours approximately, we use a stereoscope to morphologically identify the species level and sex. This is important because some female mosquito species are vectors for many pathogens. We record details in a log. Blood-fed female mosquitoes are also stored at -20 degrees Celsius and used for further analysis on pathogens and blood meal analysis.
We're implementing an integrated mosquito control program which mainly relies on the use of larvicides. In addition to our routine control program, we also receive high-frequency surveillance data from Binaiki Phytopathological Institute to intervene when high mosquito populations are detected or to manage imported cases.
For urban mosquito species such as Aedes albopictus and Culex pipiens, the knowledge, attitudes and practices of residents can influence the efficacy of management. Different studies have been implemented in Greece. Some studies, for example, examine the relationship between the number and type of mosquito breeding sites and socioeconomic or demographic characteristics of different households in Greece and evaluates efficacy of resident education. Recently, as part of the IDAlert initiative, we conducted an entomological study in Castellorizo, an isolated region situated near countries where the presence of Aedes aegypti is known or yet unknown. In conjunction with this, we used CAP questionnaires to collect information on public perception and practices concerning mosquitoes and provide valuable insights into the community's knowledge and behaviors related to these vectors.
We are here in Ψάθα, located in West Attica with a Mediterranean climate. It's a beautiful place, where on the left here is the pine forest, and on the right it's the wetland leading directly into the ocean. This is a holiday settlement during the summer with a popular beach on the shores of the Corinthian Gulf. The aquatic habitats here where the mosquitoes thrive are in close proximity to the residential areas.
Λόγω της στενής γειτονίας υγροτόπων και κατοικημένων περιοχών, εφαρμόζουμε ευρεία εντομολογική επιτήρηση και ελέγχουμε προσεκτικά τους πληθυσμούς κουνουπιών για να διασφαλίσουμε την προστασία των κατοίκων της περιοχής. Στην Ψάθα, τα δύο κυρίαρχα είδη κουνουπιών είναι το ασιατικό κουνούπι τίγρης και το Culex pipiens, το οποίο είναι και ο κύριος διαβιβαστής του ιού Δυτικού Νείλου στη χώρα μας. Ο βάκυλος είναι το κύριο βιοκτόνο που χρησιμοποιείται για την αντιμετώπιση προνυμφών κουνουπιών. Λόγω της εξειδίκευσής του, έχει ελάχιστες επιπτώσεις στους ωφέλιμους οργανισμούς και θεωρείται ασφαλές για χρήση. Προκειμένου να είμαστε αποτελεσματικοί, εφαρμόζουμε ψεκασμούς τόσο από αέρος όσο και από εδάφους.
The National Park of Marathona is a protected area consisting mostly of wetlands and marshes.
Το Εθνικό Πάρκο Σκηνιά Μαραθώνα αποτελεί έναν ιδιαίτερο υδροβιότοπο αρκετά παραγωγικό σε πληθυσμούς κουνουπιών, μεταξύ των οποίων διαβαστές ελονοσίας, του ιού του Δυτικού Νείλου και άλλα νέα είδη όπως το ασιατικό κουνούπι τίγρης. Το οικοσύστημα του Εθνικού Πάρκου Σκηνιά διαθέτει πολύ μεγάλο πλούτο πανίδας και χλωρίδας. Η μέθοδος αντιμετώπισης των κουνουπιών στον υδροβιότοπο είναι η προϊνφοκτονία και στηρίζεται στο συνεχή εντοπισμό, οριοθέτηση, χαρτογράφηση και αξιολόγηση των αιστειών αναπαραγωγής των κουνουπιών, με ψεκασμούς και αξιοποίηση όλων των διαθέσιμων μέσων. Η υλοποίηση των εφαρμογών στον υδροβιότοπο Σκηνιά πραγματοποιείται ανάλογα με τη φύση και το μέγεθος της προσψεκασμού έκτασης εστίας, από εδάφους και από αέρος, σε περιπτώσεις που κριθεί αναγκαίο με πτυτικό μέσο ελικόπτερο. Πραγματοποιούμε εντομολογική επιτήρηση για την καταγραφή των πληθυσμών των κουνουπιών, προνυμφών και ακμαίων, με έμφαση στους διαβαστές ελονοσίας.
In Marathonis, 2 local cases of malaria were detected in 2015. And since then, the Benaki Phytopathological Institute is working with local authorities in the region of Attica and the National Public Health Organisation to conduct surveillance, develop protocols for responses, and to implement control measures to prevent outbreaks.
Malaria is a serious and sometimes fatal disease caused by a parasite that commonly infects Anopheles mosquito, which feeds on humans to transmit disease.
We use entomological and land use data from previous years to determine trap locations in Attica. In parallel, 58 municipalities in Attica are suggesting sites based on geostatical representation and prevalence on mosquitoes. After morphological identification of species level and sex of mosquitoes, we create weekly interactive maps to visualize the outcomes for our stakeholders. For each trapping location, the historical surveillance data are also available. Thus, stakeholders can easily identify areas with high density of vectors and decide the appropriate time and type of intervention.
Greece is experiencing many effects from climate change. The temperatures have steadily increased and are projected to further increase. Rainfall is generally on the decline, but extreme events like storms and floods are anticipated to increase, both in frequency and magnitude, directly affecting vector-borne diseases. The control measures we've shown here are more important than ever to protect populations against vector-borne diseases now and in the future.